Hello, everyone, and welcome to Health Reform Beyond the Basics. Thank you so much for taking the time to join us today. Most of you have been a part of this Beyond the Basics project for quite a few years, but for those of you who are new, I'm Hallie Cloud, and this is a project of the Center on Budget and Policy Priorities designed to provide training and resources that help explain health coverage options available through the marketplace and Medicaid. It is aimed at healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. We are a policy nonprofit in DC, and as a reminder, this series is not intended or is intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar is a special presentation that is the last in a four-part series on core elements of eligibility and enrollment. Last week, we talked about how plans in the marketplace are designed and how cost sharing can affect what an enrollee pays. Today, we will build on that and provide an in-depth lesson on effective strategies to support people with understanding how commercial insurance works, evaluating and comparing marketplace plans, and selecting a plan that best meets their family's needs. Today's webinar will be presented by a special guest presenter, Dave Chandrasekaran, who is a training consultant and a certified application counselor who is working with CBPP. And with that, I will turn this over to Dave. So welcome, Dave.
Great. Thank you so much, Hallie. I'm very happy to be able to present again, and I wanted to thank the Center on Budget for being able to support these webinars and including me in this series to provide trainings to enrollment assisters from around the country as we approach the next open enrollment. As Hallie mentioned, I am a certified application counselor as a volunteer in Northern Virginia, and I go about once a week during open enrollment. But I know you all out there in the community are doing it full-time, 24/7, year-round, and I just wanted to thank you for that work because I do believe it's one of the more important roles we have in our communities, linking people to coverage, especially given how difficult it's been in the past few years, given all the changes to the Affordable Care Act and the confusion and challenges that consumers face in finding the right plan. So today, I'd like to work with you all to see how we can find really great strategies in helping consumers find the right fit, what plan best meets their needs. Now, before we get started, I just wanted to ask you a quick favor. If you can self-reflect on your own skills, on how confident you are in your ability to assist consumers in finding the right plan. So in your knowledge base, in your strategies, in your approach, in your effectiveness, on a scale of 1 to 10, how confident are you in those abilities? And just write that number down in front of you, and we'll come back to that later. So as a brief overview of today's presentation, we're going to first start with looking into marketplace qualified health plans and private insurance, just to understand how they work. We're then going to go in to look at some trends in the marketplace plans, things we're seeing more and more often, and things to keep an eye out for how they might impact consumers and their decision making. We'll then go on to strategies to really effectively integrate all this information to try to help consumers get to the right plan that best meets their needs. And then lastly, we're going to end on a live demo via healthcare.gov where we're going to walk through several examples and scenarios from different regions of the country and see how we'd help those family scenarios navigate the plan selection process. So we'll go ahead and get started with an overview of these qualified health plans that are in the marketplace. Now there's 5 main elements of private insurance, both the plans sold on the marketplace as well as plans sold off the exchange in the community like those that we might have. And that includes the premium, which is the monthly payment you have to pay to maintain your coverage. There's all the cost sharing associated with that plan, so the deductibles, the co-pays, the co-insurance, and we refer to all of that as the plan design. Then there's the benefits that are covered, so the services you can get associated with that plan. There's the list of drugs that you can access based on the formulary on each plan. And then there's the network of providers, so doctors, hospitals, community health centers, pharmacies that each plan has in their network. To get started, let's begin with an overview of cost sharing. And as you know, every plan will have a deductible, in this case, $6,650. And that's the amount that a consumer will have to pay of their own pocket for any medical bills they get until they hit that. And then after that, the insurance company will start paying some of their bills and they'll just pay the copay and coinsurance. There's also an out-of-pocket maximum, which is the max amount they'll pay in their copays and coinsurance to protect them from any major healthcare expenses during the year. And then as we mentioned, there's copays and coinsurance, which is how much they'd spend every time they go and actually receive care from a provider, from a doctor, lab services, etc. And then the healthcare.gov screen, as you're seeing here, also includes a summary box, which has the four most commonly sought after services for most consumers. So primary care, specialty care, generic drugs, and the ER. And that's a useful box there as you're looking at plans with a consumer, because it can kind of give you a summary of the kind of things they might be interested in most. Now, I know many of you are familiar with the different metal tiers involved in the plan sold. There's bronze, silver, gold, and platinum. And this might be useful as something you can create yourself at the beginning of the year. Pick a version of each metal tier and make a little chart like this so you can show consumers. These bronze plans have bigger deductibles, the silver has slightly smaller, gold even smaller, and platinum have the smallest deductibles, sometimes no deductibles. And then there's copays. The copays are much cheaper for the more generous plans on the right, while the plans on the left, the bronze and silver, tend to have higher copays. But of course, if you want to buy a plan that's more generous with lower copays and lower deductibles, you're going to have to pay a lot more. So premiums are much higher on those plans. The bronze plans and silver are cheaper. And for consumers, we know most of them tend to buy the bronze or silver. Now, another thing that's important to remind both ourselves as well as consumers is that there are these special versions of silver plans called cost sharing reduction plans, or CSR silver plans. And you're probably very familiar with the fact that if a consumer makes below a certain income level, they actually qualify for a special type of silver plan. If they're above 250% of poverty, they qualify for the regular silver plan. But if their income's slightly lower, they get that 73% version. And if their income's even lower, under 200% of poverty, they qualify for what we call the 87% CSR silver that tends to have much lower deductibles and lower copays. And if they're very low income, below 150% of the poverty level, they qualify for the most generous version called the 94% CSR plan, and that has very low deductibles, sometimes zero deductibles, and very low copays, sometimes no copays, zero charge copays for certain services. And in fact, these plans on the far right are even better than the platinum plan sold on the market. So one of the things we see, though, is that consumers often have a lot of difficulty in understanding what these terms mean. What is a deductible? What is an out-of-pocket maximum? What are these copays and coinsurance? And so one of the things I did in the early years of the Affordable Care Act, when I was sitting with the consumer, I might take a piece of paper and I might try to visualize this and say, let's say throughout the course of the year, you're going to have a total amount of medical bills. We don't know how much, but there's going to be a certain amount. And let's say you have a plan that has a $2,000 deductible and a $6,000 out-of-pocket maximum. So at the beginning of the year, when you go and receive care, you're in what we call the deductible phase. And so you're going to have to pay the full amount of that care for any medical bills, doctor bills, pharmacy bills, hospital bills. But if those bills add up and they end up being $2,000, well, now you've hit this deductible or you've met the deductible. And so from that point on, you're going to split the cost with the insurance company. You're just paying that smaller copay or coinsurance, and the insurance company is going to pick up all the rest of the bills. Now, that might not happen until very late in the year for many consumers, or that might hit the deductible very early in the year if, say, they have a major health issue in February or March. But some consumers actually don't ever hit the deductible. But if you do, you're now paying copays and coinsurance. And for some consumers, even those copays and coinsurance might add up a lot. Let's say if they have a major healthcare issue. And so that might even add up to an additional, say, $4,000. So the $4,000 plus the $6,000, the $2,000 we talked about earlier, that means you've spent $6,000 of your own money. And so you've met this annual out-of-pocket maximum. From that point on, you don't pay anything. The insurance company covers everything else. It's sort of a protection for you, a cot. Again, most people don't hit that, but it's there just in case someone might have a major healthcare issue. This is clearly a very simplified way of explaining these terms, but it's sort of a starting point you can use if that might be helpful to the consumer. So another really important thing I want to flag, which is could be very helpful in helping consumers find the right plan, is this concept of first dollar coverage. Now, we just talked in the last slide about how consumers have to meet that deductible first before they get to start paying these smaller copays and coinsurance. And as you probably know, that's not entirely true in every case. So here's an example of a plan from Green Bay, Wisconsin, that has a deductible of $5,200. And once you reach that deductible, then you can start paying the coinsurance or copays for these many services, like X-ray, the preferred brand drugs, specialty drugs, etc. But as you can see here, there's several services where it doesn't indicate that you have to meet the deductible. So we kind of refer to that as the deductible not applying. So on day one, you can go and get to a primary care doctor and pay the $50 copay. Or if you fill a generic drug, it's a $10 copay. You don't have to worry about that deductible. And they refer to it as first dollar coverage because as soon as you pay your first dollar in premium, you're already getting coverage and reimbursement from the insurance company to pay for certain services. Now, they do describe this phenomenon a couple different ways, and so I just want to describe the terms so that you can be familiar with them whenever they come up in the different documents or websites you're looking at. So they might say that that service, for example, the primary care service, is pre-deductible, or they might say it's exempt from the deductible. They might say that the deductible doesn't apply for this service or that it's waived for this service. They might say that it's a $10 copay before the deductible. Or they might say that primary care is not subject to the deductible. And then lastly, if you're looking at, say, that primary care line, it might just have a copay amount of $10 or $30 and just not say after deductible after it, in which case it seems like it's probably first dollar coverage. One thing I wanted to say on a related note is about HSA plans or health savings account plans. Now, again, you may be very familiar with this, but HSA plans are ones that are linked to an HSA account if a consumer chooses to open one, and they can put in money at the beginning of the year into that account, and they can do pre-tax dollars on it. So that's the general benefit. But if they want to use that HSA, they tend to have to buy a plan that's eligible for HSAs, which generally has to have a very large deductible, and it can have no first dollar coverage. So it cannot waive the deductible for anything. That's in the federal law that describes HSAs. Generally, these plans tend to be the cheapest on the marketplace because they put all the cost burden on the consumer before they reach that deductible. The problem is, for most of our consumers, they generally don't have a lot of extra money lying around to put into an HSA account. So if they buy this plan, then they're having to pay the full amount up to that deductible before they get any insurance benefits that kick in and they pay copays and coinsurance. In contrast, a plan that isn't an HSA plan is able to, waive the deductible for certain services. So here's a plan on the right, and these both plans are sold in Atlanta, Georgia from Kaiser Permanente. And the plan on the right lets you get a primary care doctor visit for $35 without having to meet that deductible. And there's several other services that are pre-deductible. But you'll notice the price difference is about $25. So for a consumer, we want to share with them, well, even though this plan is a little bit more expensive, it might add value for you if that's something that you're interested in, and being able to see the primary care doctor right away in case you need to see the doctor, you go to the doctor often. It also has a slightly lower deductible. So we're trying to help them find what's the best fit based on value for them. One thing that people often ask is, well, what counts towards the deductible? What counts towards the out-of-pocket max? So we'll take that plan we just looked at on the right as an example, and we'll describe it here in this graphic. And one of the things you can do is kind of explain to them, for example, here's these services that you have to meet the deductible first, right? Laboratory visits and preferred brand drugs. And we'll say, let's say you have some of those services at the beginning of the year that you need to pay for. And here I had to use made up examples because we don't know exactly how much labs cost or exactly how much a particular drug costs, but you can use estimates if you want. And you can say, if you pay for these services before you meet that deductible, they will count towards the deductible. So they're counting towards how much you're paying, towards that $4,700. And they're also going to count towards that out-of-pocket maximum. But now let's look at these services that are not subject to the deductible. The primary care doc and the tier 1 generic drugs, we know the dollar amounts because in this case, we know what the copays are. However, those do not count towards the deductible. So you can look at it as if the deductible is waived for those services, they also don't get to count towards that deductible calculation. However, they do count towards the out-of-pocket max. And so this is a way we can make sure consumers understand what's going to help them accumulate to reach that deductible before the insurance company kicks in. Now, one very important thing to flag for folks is that even if you get a bronze plan with a huge deductible and there's nothing exempt from the deductible, they still have access to preventive care services without having to meet any deductible, no copay, no coinsurance. And that is a very meaningful benefit to some consumers who want to buy a cheap plan. They think they're very healthy. They don't mind that it's a big deductible, but maybe once a year, it's important to them to go get their annual checkup. Maybe they have regular labs they need to get or other specific services that are recommended based on your age. So that's something to make sure we want to flag for consumers so that they understand that that's something that could be valuable for them. Another thing that's really important is even if you buy a bronze plan that has a big deductible or has nothing exempt from the deductible, there's still a benefit just by being a member of that insurance company. So here's an example of what we call an explanation of benefits, and it's a document that insurance companies will send to you after you receive care. And so in this example, we just have a couple visits to the doctor and a laboratory visit. And often what you probably recognize is that providers tend to submit what they call charges, actual charges or submitted charges. And those tend to be very, very high because providers can charge whatever they want. But whenever an insurance company negotiates with a provider, they tend to negotiate rates that are much, much lower. And so in this example, we have the dollar values here of $85 for doctor visits and $20 for the lab visits. Now, even if you're in that deductible phase, the insurance company is not paying anything. However, when you pay out of pocket, you're just paying what that negotiated rate is as a consumer. You're not paying the full cost. So you're still getting a benefit. You're still getting a discount. In this case, you're paying about a third of what it would have cost if you're uninsured. So that's another thing you can kind of explain to people who are struggling with, should I buy insurance? It's still kind of expensive. The deductible's high. Well, you still get this benefit of being a member. Now, moving on to benefits, as I'm sure all of you are familiar with, there's 10 essential health benefits that all insurance companies must cover, which is one of the great things about the Affordable Care Act, that they required this of all insurance. So no longer could insurance remove things like mental health or maternity care or prescription drugs. Now, even though these are required, I want to flag one thing, which is related to that last thing at the bottom, pediatric oral coverage. And it turns out, based on the way the ACA was set up, is that insurance companies technically do not have to cover pediatric dental if in that area they're standalone dental plans. So here's some examples of plans in the area I volunteer. And you can see on the far left, that insurance company does not cover any benefits for children. So you'd have to buy a standalone dental plan if you want that for your your child. The plan in the middle does include benefits for children's dental health, and so it would cover it. You wouldn't have to pay a separate fee for that dental plan, and the separate fee sometimes can be $10, $20, $40, $50, it can really add up. Now the plan on the right actually not only covers child dental benefits, but also benefits for adults, which is not required by the ACA. So they kind of throw it in there as an extra benefit, and so it might be useful for you to know at the beginning of the year how each of the companies in your area treats dental benefits for children and even adults. Now on a related note, every insurance company also can include additional services, which they call other coverage services. And this is the document called the Summary of Benefits and Coverage, which I'm sure you're very familiar with. Every insurance company has to create this document, and near the end of it is this box where you can look through it and look, here's the different services that any given company is choosing to include, even though it's not required. So one of the things you can do is at the beginning of the year, again, you can see all the different companies in your area, and you can compare these different services and just find out which company covers what. So for example, if a consumer needs bariatric surgery, you know which two companies covers that here. Or if they need routine hearing tests for adults, you can see which company covers that. Now, most consumers aren't thinking about these services. They're less frequently used. But if a consumer is interested in this, let's say for infertility treatment, it's usually a really big deal. And so it's useful for us to be aware of what those services are and who covers them so you can help a consumer understand that. Now, another thing I want to mention quickly as we shift into the drug costs is how drugs are treated by any given insurance company. And again, as I'm sure you're familiar with, there is 4 different categories of drugs, and those are listed here. But I do want to mention that insurance companies are starting to put some of those generic drugs into that second level. And sometimes even some cheap preferred brand drugs are dropping into that first level. So I mentioned it may not always be useful to use these terms and instead refer to them by the numbers, the Tier 1, Tier 2, Tier 3, and Tier 4, which is often how insurance companies refer to them. Now, in addition, insurance companies might create a plan that has a separate prescription drug deductible that's different from that $2,400 deductible at the top. So if a consumer has prescription drug costs, they will then contribute towards this deductible, and if they meet it, then they start paying the copays and coinsurance for prescription drugs. Many plans actually have a combined deductible. It's just one big deductible. It doesn't matter if you're getting doctor visits or prescription drugs. And if that's the case, it's going to be described here in this language where it says included in plan deductible. But again, I'm sure many of you are very familiar with this language. But for most consumers, when it comes to drugs, what they really care about is my prescription drug covered and how is it covered? And if that's the case, when you're looking on healthcare.gov, you can click here on this link to see the list of covered drugs. And then you can get an example. Let's say we go to these 2 companies and just to compare a particular drug called Humalog, which people use in case they have diabetes. And you can see here, it's covered differently by the 2 plans. The plan on the left, it's T2, so Tier 2. And the plan on the right, it's Tier 4. So that can mean a very different cost for consumers depending on which plan they end up choosing. Now let's move on to briefly talk about networks. And one of the biggest questions we get is, what is the difference between these things, HMO and PPO and point of service, et cetera? And so here's a simplified way to explain it to you so you might be able to describe it to your consumers. Every insurance company is going to have a network of providers they contract with, doctors, hospitals, et cetera. And there's also going to be doctors that are not included in these networks, or pharmacies that are not in these networks. We call them out-of-network providers. And so for an HMO, in general, the consumer has to go and see a primary care doc first to get referrals, and then they refer to them to any specialists that are in the network. And they pay a copay, whatever the copay coinsurance is. Now, if they go to a doctor that's not in network, they will get no coverage for that. They'll have to pay the whole amount of that care. And again, that's going to be the charges that the doctor charges. It can be very, very expensive. In contrast, for PPOs and often for many point of service plans, you don't have to see that primary care doc first. You can just go directly to any doctor and you pay the copay coinsurance. And if you go to a doctor out of network, they do include some coverage for it, although in general, you end up having to pay a larger copay or coinsurance. Now, more recently, we've seen plans here on the marketplace called EPOs, or exclusive provider organizations. And this was intended to be sort of a hybrid where you don't have to see a primary care doc. However, you don't get any coverage for out-of-network care. One thing I'll say about these EPOs is, even though they were described to be a hybrid, in reality, they tend to be plans that just have very, very small networks of doctors and providers as a way for the insurance company to control their costs and try to lower their premiums to attract consumers. Now, one thing I want to mention is, if a consumer is interested in out-of-network coverage, maybe because they have a very complex health condition, they need to get a lot of doctor visits, they need to go to doctors that are far outside your area, I want to mention here how to compare in this particular plan from Chicago, Illinois, how the in-network doctor, which they also refer to as participating doctor, the deductible is $750, but for out-of-network or non-participating doctors, it's a huge deductible of $15,000. And then same with the out-of-pocket max, it's a pretty high out-of-pocket max for in-network, but there's no out-of-pocket max. You're completely have to pay as much as you any care you get with no limit if you go to the out-of-network doctors. And then again, the copays are different. In-network, in this case for primary care, is $15. It's 50% coinsurance for out-of-network. So if a consumer wants a PPO, that's something to talk about, but make sure we can help them understand just that they're going to be paying quite a bit if they go out-of-network for many plans. Now, one thing I also want to mention is, people are used to thinking that if it's a PPO, it has a lot of doctors in-network. And that often is the case, but not always. So here's an example from 2 years ago from different plans sold in Nebraska, Omaha, Nebraska. And you can see here, in this case, the plan that has the most in-network doctors, in this case, primary care doctors within a 10-mile radius of the zip code that I looked, it's the plan on the bottom, the HMO plan from United Healthcare that has over 1,000 primary care docs in the area. And then Medica has the next highest. It's a PPO, so you can go out of network and in-network, but their in-network docs are 719. That's still quite a bit. But these plans from Coventry, they actually sell plans with 4 different networks. There's the point of service plan that has a particular network, and then 3 different HMO networks based on how they negotiate which providers are network, and they all have different numbers of primary care docs. So it's important for a consumer often not just to know, is this a big network, a small network, does it have a PPO or not PPO? They generally want to know, how many doctors can I go see? And so that's how you can compare that by doing something like this, by looking up the number of primary care docs in network for each plan whenever the plans become available. But for most consumers, what they really care about is my doctor in network if I have one. So when you're looking on healthcare.gov, as you know, there's a link for the provider directory, and you can click on that link and that'll take you to the insurance company's website. You can type in a doctor's name, and here's an example from Austin, Texas. Yes, this doctor is in network, and for a consumer, that's what's most important. So now we're going to move on to some trends in marketplace plans now that we're very familiar with how these plans work. And so I want to mention, we talked before about the first dollar coverage, and more we're seeing a lot of plans, especially cheaper plans on the marketplace, that have what we call partial exemptions from the deductible. So you can see here in this example, if you go for the first 3 doctor visits, you don't have to worry about the deductible. You can just pay $45 copay. But after those first 3 visits, then you're going to have to pay the whole amount. And then once you hit that deductible, you're going to pay a 50% coinsurance. So for consumers who, again, want a cheap plan, maybe it has a high deductible, the plans you might find that has this partial exemptions might offer a little bit of value if they only need to go to the doctor a few times a year. Now, when you're looking on healthcare.gov on the website, you'll notice here it mentions $45 copay before the deductible / the coinsurance after the deductible, but it doesn't mention how many visits you get. And so in this case, you can click on this link here on the left-hand side for limits and exclusions. And when you do that, a pop-up's going to come up and it'll mention how many visits. In this case, 3 visits. Another thing we're seeing is what we're calling deductible-only plans. And so here you have an example of a plan with a really high deductible, and it actually equals the out-of-pocket maximum. And when you look at all the co-pays and co-insurance, when you scroll down, it shows everywhere is no charge after deductible. And that's because once you meet the deductible, you've already met the out-of-pocket max. Now this plan often, again, is on the cheaper end of the market, but it puts all the burden on the consumer to pay everything before they hit that deductible. And if you think about it, it's kind of like a catastrophic plan. So there might be some people who are very, very healthy who feel like this is okay to have just in case something bad happens. But if a consumer has any health needs that they know about, these kind of plans might not be the best fit. Another thing I want to mention is we talked before about the 4 categories of prescription drugs. Well, it turns that now some plans are actually creating additional tiers. So in this case, they took that generic drug tier and they split them into a preferred and non-preferred. And that top tier, you now only pay $3 and you pay a little more for the generic drug non-preferred. And some of them are even adding specialty tiers, so preferred and non-preferred specialty. So there could be up to 6 different tiers for plans. And the reason that matters is because if you have a consumer that's looking at 2 different plans and they both cover the same drug at, let's say, tier 2, those tier 2s might mean different things. And so it's really important for us to flag that when we're looking and find out what is the actual copay for that drug for any given consumer. Now here again on healthcare.gov, they don't quite explain that very thoroughly. You see here for generic drugs, it just says $15. It doesn't mention there's that other tier for $3. So you'll really have to research that to find that out so that you can explain it to a consumer. Now I do want to talk a little bit about how networks are changing. One of the things we see is that when insurance companies sold plans in the first couple years of the marketplace, they often market the plans that are sold and they mention they have the most doctors in the area. But it turns out when they created plans just for the marketplace, they actually created plans that had far fewer doctors. But consumers didn't know that. And sometimes even providers don't know that. So you might look up a provider or call a provider and say, do you take this insurance company? And they say, sure. And then at the beginning of the year, consumers went to use their insurance and they said, oh, wait, we don't take the marketplace plans. And that's happening more and more frequently now as we go through the marketplace. Insurance companies are creating smaller and smaller networks as a way to control their costs. Now, some companies are not necessarily changing their network size, but they're slicing them into different tiers. And they say, if you go to this low tier, this tier 1 doc, you pay the lowest copay, but you have to pay a higher copay if you go to some of these higher tiers. And I want to show an example of it from a plan that's in Philadelphia, Pennsylvania. And you can see here for primary care, you pay a $30 copay and no deductible for tier 1 docs. And tier 2 and tier 3, it's a little more expensive. Not a lot more, but a little more. But here you can see a really big difference when you look at, let's say, the outpatient surgery. For the facility fee you pay. For tier 1, it's a $250 copay and there's no deductible you have to worry about. But for tier 2 and tier 3, not only is the copay bigger, it is also subject to the deductible. So you could be paying thousands of more dollars for the same exact procedure, depending on which provider a consumer goes to. And so if there's a tiered network in any given plan in your area, it's important to make sure you understand that and can explain that to a consumer when you're looking up their providers. Now, another thing that's really important to remember is that there are huge major inaccuracies in these directories that we're looking up, these provider directories. And this is a study done by a good friend of mine, Claire McAndrew at Families USA, where they actually called providers that were listed on the health plan sold in the Maryland marketplace. And they found out here that there's many, many errors. Less than half of psychiatrists were actually at the numbers they reached. And that might be because the provider moved, maybe they retired, maybe they no longer see new patients or they no longer take that insurance. Sometimes the provider has passed away for many years, but the directory was never updated. So I always mention that if a consumer is making a decision on which plan to buy, that's very heavily dependent on which one it has their provider in network, that we always call the insurance company and call the provider. And I even say, get the name of the person that told you that information to make sure in case they're mistaken, that you can try to push back and see if there's a way to resolve that. Now, I do want to mention that when you're looking up if a provider's in network or not, healthcare.gov does have a tool to search for both providers and prescription drugs. And when you're looking at the plans in the upper right-hand corner on the anonymous browsing site, you can click on that link there, and then you can type in a given doctor and you can see, are they in network or not? And you can also do the same thing for the prescription drug. And then when you go back and look at the plans, you'll see here it has a box on the far right that says, is a drug covered, is a doctor covered? One thing I will mention is that I've noticed over last year, there was a number of errors, and it often would say a doctor's in network, but then when I checked with the company, their website said it wasn't, or vice versa. So last year I recommended not using this tool because it wasn't accurate enough. And for prescription drugs, it just says is it covered or not, it doesn't say what tier. So you're gonna have to look that up anyway. So far this year, the directory looks to be more accurate, and what I'm gonna do is I'm gonna study it over the next month, and if by the end of October it looks like it's more accurate this year, I'm gonna mention that, and the Center on Budget and others can share that with you, so maybe it is a useful tool, because it does save the step of having to go to each company's website. The other thing I wanna mention though is the problems you all are facing, because if you have to go look at each insurance company's site, if we don't have a lot of tools to help us shorten the appointment, that makes it harder and you have to have larger appointments. But this is at a time when the money has gotten very, very reduced for many Navigator programs. So I recognize that, and I recognize how tough that is for most of you, and I hope that you're able to sort of survive and partner together and manage this coming open enrollment, which I know can be tough for many programs that have faced that reduction in budget. So now I want to move on to strategies to help consumers. Hopefully some of these can help you make these websites, make the process a little quicker, some of these tools, so that you can try to shorten that appointment time to see as many consumers as you can during these open enrollments. The first thing I want to mention is at the beginning of the year, you can take a look at all the plans sold in your marketplace, and you can compare them from year to year, and especially focus on the 4 cheapest silver plans, since that's often what consumers end up buying. And just get familiar with what they are, get familiar with what changed from year to year. You can see that in this case, there's insurance companies that are no longer selling in 2018 that they were in 2017, the green one. And you can see the cheapest plan is now the purple plan, the Kaiser plan. And that just helps you get familiar with what plans consumers are often going to look at. In addition, you can maybe make a chart comparing the different networks, because consumers may often want to know which plans have enough doctors for them. So here I did a search for these different plans of all the providers within a 5-mile radius of the zip code I volunteer in. And I looked up not just primary care, but also different specialty categories. And depending on what kind of provider you are, or where you are and what kind of patient needs there are, you can decide which specialist to look up. And this shows you there's a pretty big difference based on the different networks sold by the plans in my area. And so for a consumer, if that's something that's important to them, you'll be familiar in advance of which companies have different types of networks. Another thing that might be available for you in your area is this tool that my partners at Consumers Checkbook developed over the past couple years. And they pulled the plans from every zip code and every county in a given state for several states in the past couple years. And they developed a table for every metal tier, silver, bronze, gold, platinum, and they even pulled it up for all the plans not sold in the marketplace. And this just shows you the plans in order of price, and we color code the different companies so you can kind of scan them and maybe study them in advance to kind of get familiar with the plans and their deductibles and their copays. And one thing that's really neat is we've able to put, based on the shading, which services are pre-deductible, so which are first dollar coverage. So you can even maybe use this tool with the consumer as you're looking at the different plans to kind of get a sense of, do you want a plan that has say a deductible that's below $3,000 or $4,000, but also has some first dollar coverage? And you can scan and get a sense of which plan does that, and then see, is this price range affordable to you? We're gonna see if we're able to do this again, and if so, we certainly can let folks know that and share that with your given state network, so you'd have this type of document for every county in your area. Now next, let's really talk about tailoring the search for how a consumer needs to pick plans. And the first thing is, are they a renewal or are they a new applicant? Because if they're a renewal, that means they had insurance last year. So you can ask them, how was that insurance? Did you have a good experience with it? Did the deductible pose a problem? Was the network okay? If they're a new applicant, you might focus more of the time on getting them enrolled and getting that tax credit amount and then explaining the insurance process. The other big thing, of course, is do they have prescription drugs? Do they have any providers? How important is it for them to keep seeing those providers? What is the coverage for those things? And I'm sure many of you are very familiar with prioritizing this issue. One thing I will flag is sometimes I've had consumers that didn't have any prescriptions and didn't have any doctors, but they actually still had major health needs that we didn't talk about until the end when we were finally looking at plans and almost picked one. And it turns out some consumers might say, well, I need this surgery, but I've been putting it off for years. Maybe this year I'll look at it. And that means they do care about networks. Or maybe they got an injury recently and they need to see rehab services, but they don't have any prescriptions for that. Maybe they aren't seeing a consistent doctor for it. So we want to take that into account as well as we're looking at plans for them. And then finally, the thing I've been mentioning a lot is this first dollar coverage. And a way you can balance the cost of a plan with different elements that might show value is you're scanning across here, and so you look at the premium, you look at the deductible, but then you focus on that summary box I mentioned. And you can see here in this listing, the plan on top doesn't have any first dollar coverage. And the second plan, as you scroll down, it actually has some first dollar coverage for generic drugs, and it looks like a partial exemption for primary care, but it's a little more expensive, about $15 more expensive. And then you can scroll down more and see how are the next plans. You see here these two Blue Cross plans. Again, the deductibles are big, the premiums are starting to go up, but it has some first dollar coverage for primary care and for specialists. And you can continue scrolling, and as you're doing so, the prices are going up, so consumers might get less comfortable with what their price they can afford, but you might see here now this plan on top has even more first dollar coverage. And that's a way you can kind of balance those different elements for consumers as you're scrolling. So now I really want to talk about trade-offs though, because that's what this all comes down to. It's the trade-offs between cost and some other things. And the first thing you often see is the trade-off between bronze and silver. Many consumers struggle with that. You have a bronze plan that has a lower premium, but usually a much higher deductible and higher copays, versus a silver plan that has a higher premium, but lower deductible, lower copay. And we can talk through what is the most important thing for them. How do they feel about paying more per month, but less at the doctor visits versus vice versa. Another thing we do see though, is that you often have to take into account the provider search. And we might see that a plan that's the cheapest may not have their provider network, but there's a plan that's more expensive that does. And in this case, the real question to ask them is, how important is it to keep seeing that provider? And are you okay paying about $40 more to see that provider? For some consumers, it won't be the case, but for some consumers, they'll say, okay, sure, I don't mind it. Some consumers are even okay paying $75, $100, even $150 more per month based on some focus groups we've done. And so that's an important thing to help consumers understand the trade-offs of having their doctor versus price. One thing I've seen in some of these consumer groups is that people are saying that consumers will take a bronze plan that's cheap because they say, well, I can just go to the FQHC nearby, I can go to this free clinic, I can get a discount drug card, I don't mind, I can get my care sort of in a cheaper way and don't have to worry about that big deductible. And some consumers even say, well, you know what, I have access to other places to get medical care. So here's an example just made up from, say, El Paso, Texas, near the border, where a consumer might say, well, I happen to have family across the border. I visit them once a year, and that's when I go and take care of my medical expenses. I'll just buy a bronze plan in case something really bad happens during the year, but I'll just take care of most of my regular medical stuff across the, when I happen to travel. And this is true not just of border states, but there's a lot of consumers who live even in my area, in the DC area, who happen to visit family abroad, and so they're able to get their care that way. One of the things we really need to talk about, though, is consumers struggle with this, let's say this bronze plan that's $180, has a huge deductible, and so is it worth buying? Why even bother it? And so then we can remind them, remember, there's that preventive services where you don't have to worry about any copays or coinsurance or deductibles. There's these negotiated rates you get to pay instead of the full cost. And let's talk about risk. If you don't buy insurance, if something major happens, you have to pay that full cost, and that can bankrupt you. So are you comfortable with that? Or is it worth paying this $184 just to protect you just in case? Now with that, I want to pause here and see if we have any questions. We can take a few questions here before we go on to the last section. So I'm going to turn it back over to Hallie and see if we have any questions in the queue.
Yeah, and we'll take a few questions right now, and then we'll do most of them at the end so we have enough time for the presentation. But we did have a question on the consumer checkbook that you mentioned, that tool. If we can get a link to everyone, and yes, we can get a link and send it to you guys. We'll add it to the slides too. I don't think they're in there right now, and it is not updated for 2019 at this point. Correct, Dave?
Yeah, I just want to mention they're open to doing it again, but it's a very resource-intensive work to do it for every state. And it really depends on when the plan info comes out. Does it come out early enough to do it from the feds or from your state? And so we'll let you know, and we'll alert which states they're able to work on this year for it and share that. It probably won't be every state, and so we apologize for that. But for those we can get to, we'll make sure you have access to it.
Perfect. And then you mentioned this, but just to sort of clarify, when a consumer chooses a plan with a high deductible and must meet that deductible before they have any copays, when the consumer goes to an in-network doctor, they will be charged the insurance company's contracted rate and not that full amount. Is that correct? Correct.
So that's one of the benefits of going to insurance is they pay the negotiated rate, even if they're still in the deductible phase.
And then we talked about the different kinds of plans, HMO versus a PPO versus an EPO. So are referrals required for specialists under an HMO plan?
They generally are. That was generally how HMOs were created, was to sort of have that gatekeeper model. But some insurance companies have HMOs where they don't require that. And so it's different for each one. You sort of have to check with the insurance company, and it'll often say it in the summary of benefits for specialists, referral needed, that kind of stuff.
Perfect. And we will do the rest of the questions at the end. So again, the question box is if you click the little Q&A icon at the bottom of your webinar toolbox, it'll pop up the questions. You can type questions in, and we'll sort of monitor them and answer as many as we can at the end. And we'll probably stay a little bit extra over time to answer some questions. So take it away, Dave.
Great. So now let's move on to our demonstrations. And we're going to be doing a live web browsing of several different scenarios using actual 2018 plans. And to start off, we're going to use our first scenario is Jennifer from Austin, Texas, who makes $30,000 a year. And again, through the course of helping her, one of the things we'll probably do is really talk about what is her health status. Does she have any providers? Does she have any prescription drugs? What are her priorities? And in this case, you might see this very often. You'll see someone who might be slightly younger, relatively healthy, doesn't have any providers, really just concerned about cost. I don't really use the doctor much. I don't go and get healthcare a lot. I'm looking to see, is there something that's affordable for me? So we're going to go ahead and go on to healthcare.gov, and we're going to look at her particular example. So we're now looking at an actual live screen of healthcare.gov, and we're going to type in her zip code to find out the plans that are in her area. And one of the things that'll ask you when you're using this anonymous browsing flight is who's in the household. And so I'll mention it's just her and that she's 32 years old. And it'll then ask us for her income, which we'll put in here as $30,000. And you can see here it estimates that she might get a tax credit of about $172. And so we can go ahead and look at the plans that are available in her area. And we see here that the cheapest plan available is an $87 Oscar plan. Now, most consumers, whenever they see these first prices, they might be shocked. They might have had different notions of how much insurance should cost. And they often base their entire search based on what is this cheapest plan. So if you see here, I can click here and look on this plan. It has a pretty big deductible, $7,350, and that actually equals the out-of-pocket max. And when you scroll down, you can see there's no charge after deductible. So this is one of those deductible-only plans. Now, maybe she says that's fine. She'll consider it. And wants to see what some other plans are. So one of the things we might want to mention as we scroll down is, are there any plans that have some first dollar coverage? If that's important to her, maybe we explain that and she realizes that could be a good thing. We're scrolling down here and looking in the cheat box, and we're seeing that so far none of these plans happen to have any. And until we get to this plan that's $126 by Ideal Care, it has primary care docs at $25, and it has generic drugs at $5 without having to meet the deductible. Although the deductible is still pretty high, $6,500. But maybe this is okay, so we can click compare. And now one of the things she might mention is, well, these deductibles are really high and that makes her a little uncomfortable. Yeah, the prices are high, but she's like, what are any plans that have lower deductibles? So we can maybe suggest, let's look at some silver plans. And so we can click on the refine results, the filtering tool, and click on silver. And we'll check out what the silver plans are. So here you can see the cheapest silver plan is $201, has a much lower deductible of $2,000, although it doesn't include anything pre-deductible, which we're looking here in the fourth box. Here's the plan right below it. It's only about $2, $3 more expensive, and it does have some care that's pre-deductible. The deductible is a little higher, but again, for the visits that she might go as someone who's relatively healthy, she may not have to worry about the deductible. So maybe we can include this plan as well. And so now we can compare these three plans side by side and help her see what might be best for her. Now, one of the things I see is that the plan display here isn't always the most user-friendly because it doesn't always line up. It doesn't show a lot on the surface together. So I often use for these presentations this sheet that compares plans side by side. And it's a document that the Center on Budget actually has, and we'll be sharing links later that lets you fill out this information, because it sometimes can be better to do this than even what's shown on the website, because you can include not just the information on the plans, but you can tailor it. So you can add the doctor network stuff, you can add, is dental coverage, is there Spanish-speaking providers, et cetera. And so in this case, we can see here, here's the cheapest plan, that deductible-only plan. And then the plan that's more expensive but has some first dollar coverage. And then the silver plan that's much more expensive but has even more first dollar coverage and a lower deductible. And so now we can talk through her priorities to figure out what's the most important for you, how do you want to balance costs versus these other things. And for every consumer, it's going to be different. She might say, okay, I just want the cheapest plan. Maybe she'll say, I want that lower deductible plan. She might be so confused and just say, well, can you just tell me which plan to buy? And I'm sure most of you all are very familiar with this because a lot of consumers might say that. And we know that as the sisters, we are not allowed to tell a consumer which plan to buy. We're not allowed to say which plan we consider best, nor can we say, here's the plan I'd recommend for my parent. But even though that's the case, I want to make sure you realize that you should not avoid, though, what you're allowed to do, which is you can really talk in very great detail about these plans and help understand what their priorities are. So for example, if she says, I just can't spend more than 150 bucks. Well, you can say, okay, the one on the right doesn't meet that criteria, so let's look at the two that are on the left. And she might say, well, I don't go to the doctor that often, but you know what, I do go a couple times a year, and I have this thing that's lingering. So maybe what do you think about the plan in the middle? And you can say, well, I can't advise you on that, but if it's interesting for you to see the doctor a couple times and you only have to pay the $25, well, this plan, it's $50 more expensive, but does that seem like that's something you can afford to be able to see the docs and get these tier 1 drugs without having to meet the deductible? And so it all comes down to their priorities. Is it just paying the cheapest amount, which might be what she came in thinking? Is it having manageable deductibles and copays and maybe having some of that first dollar coverage? So everyone's going to be different, and in talking to them, we can kind of help them identify what their priorities are and figure out what plan is best for them. So now let's go to our next example. It's a couple from Jacksonville, Florida that makes $24,000 a year. And so again, we're going to talk extensively about their health needs, and through the course of our conversations, maybe they mention that Jim has diabetes and he takes some medication for it, and he also gets some lab work done that he needs to do pretty often, so he wants to know how much is that going to cost. And maybe his wife, Michelle, sees a particular OBGYN and really likes her and wants to see if she can continue to see her. So again, we're going to go to healthcare.gov and we're going to look up their situation. So we'll go here and we'll change the zip code so that we'll get the zip code for their area so we can see what plans are available for them. And so we'll choose here in Duval County. And in this case, there's 2 people in their household. So we'll say it's the applicant and other people, and they're married, but it'll ask for dependents, and we'll say that they actually don't have any dependents. Because let's say they have grown children who've all moved away and aren't on their taxes. So here we'll build their household again. We'll put in the information for both of them, for their ages and genders, and then it'll ask us for their income. And so here we're going to put in their income of $24,000, and it'll eventually take us to their plans. And so now we can see their plans, and the first thing we notice is the cheapest plan is actually free. And a lot of consumers love the notion of free insurance. It even has some copays that are pre-deductible. However, before we jump into that, we know that they mentioned that they have some providers and some drugs. So we can click here on the upper right-hand corner, and we can type in their information. And so we'll put in their doctor's name. And we can see here that they are, in fact, listed here. And so we can include that in the search. We can also include the drug. One thing you'll need to notice is that it'll require you to have their dosage. And if a consumer brings their prescription vial or knows it, that helps. If they don't, that can be a little tricky. But so now we've included this, and now we'll see what is available for them. And before we get started on Bronze Plan, remember, they actually, because of their income, they actually qualify for CSR plans. And you'll see that certainly when you're helping them. And so we might suggest, why don't we look at Silver plans first? If you don't mind, we can always come back if they're too expensive. But you qualify for these really lower cost Silver plans when it comes to deductibles and things. You can see here the cheapest one is $47, and it has a much lower deductible than Bronze. And the primary care doc and generic drugs are free. There's no copay for them. Now they mentioned they care about labs, and so we can click on details and look up the labs. And we can scroll down here, and we see labs are actually no charge, but they do have to meet that deductible first. So that's something to consider. Now, one of the things we mentioned is that for prescription drugs, it doesn't mention it here, what tier it's at. So you can click here on the list of covered drugs, and it'll take you to their search site. You can type in the name, and it'll tell you what tier it's in. And so in this case, when we did that, we actually found that it's at tier 1. So maybe they say, well, this plan's interesting. Maybe we'll consider this plan. But let's see some other options that might exist. So maybe Michelle is interested in finding a plan that actually includes her doctor as well. And we want to find other plans that maybe have some lower deductibles. So here's a plan from Ambetter. It does include the prescription, and it has a slightly lower plan, but it does have some low copay, so we can include that one just because as a comparison. But if we want to find a plan that has their doctor network, we have to keep scrolling down. And eventually we get to this plan from Florida Blue, that has, it actually, when I looked it up, it does have their doctor and network, but this is one of the areas where it has an error. And it has no deductible. So it's free deductible and very low copays at $1, $2, etc. So maybe we can include this plan. And so now we can compare these three plans side by side, but once again, we'll go do it on the slide for my, on the slide deck because it can show them a little easier. And so here are the three plans available to them. The cheapest silver plan that has a pretty low deductible and some things pre-deductible, but doesn't include the doctor. The plan in the middle that has a slightly lower deductible, but it's $30 more expensive. And the plan on the right that's quite much more expensive, but has no deductible and includes the doctor. So once again, we're talking about trade-offs. How important is it to see the doctor in network? Is it worth paying all that more money to them, or can they afford it? And what can they afford versus what deductible, et cetera. And so once again, we can talk through their priorities, like the doctor in network, how important is that? The drug covered and how much does it cost on each company? And then what's really the best plan for their condition? So we take into account the labs, we take into account other services that the consumers might need. So I want to run on to the next example, which is a family of 3 from Milwaukee in Wisconsin. And so in this case, we again talk about their health status, and they mention that their daughter has asthma and sees a particular doctor for it and takes a medication, and that the husband is looking at considering a procedure or a surgery, and someone recommended this particular hospital for that. Let's go ahead and do their example now. And so we'll go ahead and we'll change the zip code again to find the plans that are available in their area. And so in this case, we'll put in the zip code for Milwaukee. And we'll put in the information of their household, which in this case, they do have a dependent. And we'll put in the ages of each family member so that it can estimate the accurate tax credit. And when we put in their income, which in this case is $36,000, it'll come up with an estimate of quite a big tax credit of $1,400, and it estimates that they're eligible for these special silver plans. And in this case, their FPL comes out to about 160%, so they're eligible for that middle range, the 87% silver plans. So now let's once again go look at the plans available to them. So in this case, you'll see that the bronze plans are very cheap. It's 52 cents for the bronze plan, although this has a huge deductible, and again, nothing exempt from the deductible. Now, often consumers will really compare all plans on that cheapest plan, and so in this case, they might suggest they want to compare this, but we know that they are eligible for silver CSR, and so we might say, well, why don't we look at some of those silver plans as well? And if you really want that cheap bronze plan, you always can consider it. But here are some silver plans. And you can notice the price jumps quite a bit, up to $100, but the deductible is only $1,000, and it looks like many things are exempt: the primary care, the specialist, and the tier 1 drugs. Now, it does, what we do want to see about their doctor, and so we can look up Dr. Lopez, and so we can type in the doctor's name here and see if, in fact, the doctor is in network. So we'll type in the doctor's name, and we can see in this case, it's an internal medicine doc, pulmonary disease, so make sure we choose the right one. We can also choose to look up the healthcare provider, and so we can type in the name, and make sure in this case we're choosing the hospital here, because that's what he mentioned. And we also can look up the drug, Advair. And again, we'll need to know the doses. In this case, it's this dose here, 0.5 milligram. So when we go back to the plans, it now is going to compare the different plans based on whether they have the doctor or network and coverage. And so you can see here on the plan on the right, the Tailored Care plan, it doesn't actually include the doctor or the drug and network. And we can scroll down and compare each plan to see which ones that they might look at. And we can see, do they want to make sure they include the doctor and network? And if so, we can click on this plan here, the $158 plan here. And we can look at some others. We see that this silver of $102 is the cheapest one. They may want to consider that. And so as we develop the comparison tool, we can fill in all of the different information. So here we have 3 plans: that very cheap bronze plan, huge deductible, but Common Ground does have the doctor network and does have the doctor and covers the drug at tier 2. Here's the plan in the middle that has a lower deductible. It's $100, has some things pre-deductible, but doesn't have the doctor or the hospital network. And then the far right plan is much more expensive, $158, but again, some pre-deductible coverage and doctor and hospital or network. So maybe one of the things they say is that it actually is worth having that provider in network. And so they say, why don't we, we can remove the plan in the middle. The biggest struggle, as we mentioned, is between a cheap plan with high deductible and a plan that's much more expensive but has other things that might be beneficial. So one of the things we can do is let's actually see, based on your healthcare needs, how much would you pay at the end of the year depending on which plan you buy. And so we can look here and ask them, how many times did you go to the doctor last year? Or how many times do you think you'll go to the doctor this year? So they might mention that they go to the primary care doc 5 times, the specialist doc they think about 5 times. There's the prescriptions they need to get and how often they need to fill it. And then one of the things they might mention the surgery that the husband mentioned. And so you might look up, let's say it's knee surgery. You could actually Google average cost of knee replacement surgery in your area. And so just to get estimates, because it's hard to know how much these actual cost. And then we can actually fill in how much it costs. Well, we know the premium times 12, but because that deductible is huge and there's nothing pre-deductible, they have to pay the full cost of care for these different services. And that's gonna end up being that they'd estimated cost over $7,300. Now the plan on the far right is much more expensive. So in premiums, they're gonna spend almost $2,000, but because there's a lot of pre-deductible coverage, they'll just pay these copay amounts for this. And even though the deductible needs to be met for the inpatient stay, it's only $100. And when they pay the $100 plus 20% of the balance, it's a much cheaper amount. And they end up paying, in the plan on the right, an estimate of $3,500. So they can see, even though the plan costs a lot more, if this is the kind of healthcare they might need for the year, they're spending about half with the plan on the right. So that can help them understand what their priorities might be. And again, in this case, we talk about hospitals and facilities, how important is it? But then there's also this estimate of how much they'll actually pay, both in premiums and in copays and coinsurance, comparing each plan for their actual needs, their predicted amount of healthcare use. So with that, we're gonna go ahead and see if there's any questions. I know we're running short on time, but we'll see, Hallie, if we can take any questions before we pause and conclude the webinar.
Yeah, so we have a couple questions, and again, you can type them into the Q&A box. You can also email us after the presentation. We'll have our contact email, so if you need to drop off, go right ahead and you can just email us. But someone actually had a question about the comparison tool and if there's a way to kind of copy and paste what's in healthcare.gov and just like import it into the comparison tool, or if you have to do it manually. And you do have to do it manually, but Dave can kind of take suggestions on how to do it and why it's sort of important to compare things in a sort of apples to apples kind of way. So.
Sure. So unfortunately, one of the things we had hoped from year one was that there was a way to sort of download the data into a more user-friendly, interactive format. That doesn't exist, unfortunately. And that's why we made this static sheet that's a PDF that you can type the information in, or you can print it out and write it in. One of the things I found is if you're actually writing that information in with a consumer, it allows you the chance to actually explain these terms, and it helps them in a more interactive way really understand what this deductible means, what's pre-deductible. If you're looking up things like how many providers are in network, you can write that at the bottom, which healthcare.gov doesn't let you integrate. So it is a useful tool, but we acknowledge it is much more time consuming.
And then a couple people had a question about the provider and drug lookup tool on healthcare.gov. We were sort of using it for our examples because it can be really helpful when you're sort of searching through plans to get a quick guide of whether a doctor is in network or not. But you had mentioned how there's definitely a lot of errors. Other people have run into a lot of errors. So how to deal with that? Is it even worth using that lookup tool?
So I'd say with the prescription drugs, because you're going to have to look it up in a second step anyway to find out the tier, you could skip that. However, it is useful to see if a drug's in network or not, covered or not. And so if you do that, assuming it's accurate, which I think the drugs information is a little more accurate, it can be useful as you're doing that scanning process and you're scrolling down and seeing, is the drug covered, which plans do you want to look at more in depth. But you will have to do that second step. With the doctors, as I mentioned last year, the errors were so high, over 50% inaccuracy, that it wasn't something I could recommend using. I'm hoping this year it's better, and so far it has had far fewer errors. And like I mentioned, in a few weeks after I do more presentations for different partners around the country, if it looks like it's more accurate, I can mention that to our partners at Center on Budget, and they can, in an update, they can say the drug tool does seem like it might be worth using, or they can mention, it looks like we're still seeing a lot of errors, and you can decide if it's worth using or not.
And then we had a question going back to sort of the plan design and talking about copays or coinsurance that's pre-deductible and whether those count towards the deductible, or does it depend on what the plan allows?
So again, if something is not subject to the deductible, that means in general that they won't count towards the deductible. So it's sort of like if the deductible applies to that service, then when you pay for that out of pocket, the cost of going to a provider, it's going to help you accumulate towards that deductible. But if the insurance company is letting you not worry about the deductible for, say, primary care or for specialty care, you also don't get the benefit of having those payments count towards the deductible. So in general, that's how it works. There could be some variations for some plans, but I haven't seen any variation.
And then for our last example where we were with the family of three and we had one plan that was very, very cheap but had that family deductible that was 14,000, I think, and then the other plan was much more expensive as a premium, but the deductible was only $100. Is that deductible the family deductible or is that an individual deductible?
Yeah, I appreciate you bringing that up. So I didn't flag, because I know it's been covered in previous webinars, that if you're looking for an individual, when you type in that it's an individual and you look it up, it'll show the individual deductible. And when you have a household that's bigger than one person, it'll show you the deductible for the whole family. And they are different. As you know, the family deductible is generally double what it is for an individual. But when you're looking on the screen, it'll show you the deductible that applies for that given household scenario. So you don't have to worry about explaining the different ones. Whatever they show on the screen, that's the one that's going to apply for that particular household that you're working
And then we had a question about there's a fair amount of states or counties that only have one insurer that sells on the marketplace. And in those cases, for plan comparison, is it still worth sort of going through all of the plan comparison um, of these plans if there's only one insurer?
So I know that is true in many, many counties, especially over the years. And it might, if there's only one insurer, they still might have different networks. So they might have a PPO and HMO, they might have several HMO networks. In that case, there may be differences in whether a doctor's covered or not. So it is useful to compare. Even if they only have one network, clearly they're going to have different deductibles, copays. They might have several bronze plans, several silver. Even if you're just comparing the bronze and silver, there are differences. So it might reduce the number of plans you are sort of looking between and choosing which ones to look at more in detail, but there's still going to be differences. And so it's still worth looking at things side by side so they can understand which might fit their needs best.
And then we'll take one more question. Someone had a question about with the penalty being zeroed out for 2019. Does that mean that next year, if someone does decide to go without insurance, that they wouldn't pay that penalty for not having insurance?
So, and I can defer to you as well, Hallie, but it is true that without the individual mandate, there technically is no fee that you're going to have to pay as a penalty if you don't have insurance. That is obviously something that's going to make some consumers who would have bought insurance because of the penalty, they may consider not to if they think it's expensive. We know that may be the case for younger folks who might be healthier and think they don't need it. But those young, healthy folks are ones that we need to make that risk pool better. And so if that's the case, it means the prices are going to go up. And as you heard from last webinar where we talked about short-term health plans and association plans, these are other things that might kind of siphon off people who are younger, who are healthier. And so it leaves folks who tend to have more healthcare needs in the marketplace because, it has better coverage. And that might cause prices to go up more from year to year. And so that is something to keep an eye out for and is concerning, but unfortunately there's nothing we can do about that right now.
Yeah, and another thing just to add to that is when you're talking to people, there are regardless of whether there's a penalty, there's real benefits to having insurance, and especially insurance that is on the marketplace that is ACA compliant. There are all sorts of rules and protections for people who have these plans. So even if some of the costs seem really, really high, you get things like preventative services for free. You have some of those plans have the pre-deductible copays. You get negotiated rates instead of having the just sort of the huge rate that whatever a hospital wants to charge, that you have sort of a negotiated rate that you'd pay even if you haven't met the deductible yet. And so all of those things are really important things to discuss with people when they're trying to decide whether they want to buy insurance or what kind of insurance to buy. So that's sort of another thing to keep in mind. And then oh, and also that the penalty goes away or that is zeroed out in 2019. So that's uh, on the timing on that. But with that, I think we're going to, Dave has evaluation that we'd love for you all to fill out. It really helps sort of improve this presentation year to year. Again, if we didn't answer your question, I know you have a lot of questions and they're all really, really good. So if you have a question that didn't get answered, or if you have a follow-up question, Dave will put up on the screen our contact emails in just a second, and you'll be able to email us. And again, we'll send around the presentation, so you'll have both my email and then all the contact emails on the slide deck. So go ahead, Dave.
Great. So one of the things I really appreciated, as Hallie mentioned, is getting your feedback on these presentations so I can continually improve it from both this year, but even into next year. So if you wouldn't mind, and you can do this right now, you can type in that URL that's there, http://tinyurl.com/writefiteval. The eval takes 30 seconds, if not less. Or you can do it afterwards when you get the link in the subsequent emails we'll send around. The questions are basically the same thing we asked in the beginning. So that number you wrote down, you might want to change the number based on what you saw in this presentation. Maybe you think, well, I said 7 before at the start of the presentation, but maybe based on what I saw, I actually was a 5 before the presentation. Or it might be the same number. And then how do you feel now? Now that we've done the presentation, do you feel more confident? Do you feel like you have more skills? Do you feel like you have a better ability to help people? Obviously, my whole plan is whatever your number was before to try to improve it so that you feel more confident and more able in this plan selection process. And then 3 quick questions. Was there anything that I didn't cover that you thought should be added to this presentation? A topic or some kind of thing that you feel like should be included? Was there anything in the presentation that you thought wasn't useful? Maybe it was too basic. Maybe it just doesn't need to be in the presentation. And then lastly, was there anything in the presentation that you thought wasn't explained well enough? Maybe it needed more time. It just didn't come across in a way that helped you understand the concept. Those are pretty much it. And with that, I'm going to mention the Marketplace Plan Comparison Worksheet that we talked about. It's available both in English and Spanish, and again, we'll circulate it. There's some other resources, as you know, on Health Reform Beyond the Basics that the Center on Budget has been developing, some fantastic tools. And so you'll be able to go there and download all of that. And then lastly, our contact info, if you need to get in touch with us afterwards, you can do so. So I'm going to turn it back over to Hallie.
Thank you, Dave. And again, I know that the links don't work, but we'll send all the links to you guys after the presentation. You'll have the slides, and we also are recording this, and so you'll be able to rewatch the video or share it with others. So you will have all of that. We will post all the materials from today's session on our Beyond the Basics website at healthreformbeyondthebasics.org. They will probably be up tomorrow. Our next webinar is scheduled for this Thursday, September 27th at 2 p.m. Eastern, 11 a.m. Pacific, and it's going to provide an explanation of the auto renewal process for coverage in 2019. So if people don't come back to the marketplace and they are enrolled, how they would be auto enrolled and kind of the complicated process for that. You can register for that webinar and our other upcoming webinars on the Beyond the Basics website under upcoming webinars. Once again, all of these materials, all of these webinars are posted to that site. We have reference guides, frequently asked questions, and these key facts that are sort of Q&A on certain topics. If you have any questions, need assistance going forward, please email us. And if you have any ideas of resources that you would love to see that we don't have, please shoot us an email, and we will. We love getting ideas from you guys. You guys are the front lines for us. So any way we can help make your life easier, please let us know, and we will do what we can. So with that, I'm going to bring the webinar to a close, and thank you again so much for joining us today. And thank you, Dave, for being our special presenter today.